Whoever thought I'd be the greatest growing up?
Hi, I'm Greg Heuer. I'm one of the neurosurgeons over at Children's Hospital Philadelphia, also known as CHOP. And this is Jesse Taylor, my partner, who's a craniofacial surgeon. Today we're going to talk about a unique case that we were involved with of a special set of twins. This is Aaron and Abby Delaney. These are twins, and you can tell they're joined at the head. It's a term we call craniopagus. And what we're going to do today is tell their story. I mean, sort of how we were involved in their care. And along the ways, we're going to describe something along the lines of innovation. So a lot of talks today they were super inspiring. And we talked about innovation and how important it is. But I want to lay out a little bit of groundwork that innovation in medicine is a little bit different. The biggest one is patient outcome. So while you may have an innovative iPhone and it doesn't work, you bring it to the Genius Bar and they fix it. It turns out patients' families don't really like the trial and error method for treating their kids. You don't say, well, with the first 5 children you have, we're going to try this, and we'll get it right on that 6th time. So patient outcomes, you can't not look at it when you're thinking about innovation. And so that's paramount, and it makes it different than any other sort of field of innovation. The other thing, and I think you'll see this in our talk, is we try to work within the biological system. We're trying to utilize the biological system, the healing properties, the normal growth properties, and use those to our advantage. And I think that's one of the central themes. And lastly, there's 2 of us here today, and it's not because I don't have the stamina to do the entire talk. One of the themes is teamwork. And what you'll see is the teamwork that we've developed wasn't for this case. The Eagles didn't win the Super Bowl by becoming a team the day before they were going to play. Teamwork involves sort of working together and establishing that network of working together long before you try to tackle a difficult task. And I think that's a really important part of this. So let's get back to the story. This is Heather Delaney. And in May, recently being married, finds out she's pregnant. Then she finds out she's pregnant with twins. So put yourself in her shoes. She then finds out at one of her OB visits, something's wrong. And we don't know what it means. Can you imagine how you'd feel, how nervous you'd feel? She then says, well, where should I go to find out about this? And luckily, there's centers like the Children's Hospital Philadelphia with fetal centers. So while still pregnant with her twins, she comes to see me and some of the other doctors, and that's where we begin her treatment. It's even before the kids are born. It's in talking with her, establishing what's going to happen, what can happen, knowing what her expectations are. That's where the treatment really starts. She's 20 weeks pregnant at the time, and we go through all the different scenarios, how serious this is, what we think we're going to do. And then on July 24th, we meet Aaron and Abby for the first time. They're born 10 weeks premature because their cords were entangling. So they had to be born or they could have passed away. When they were born, they weighed just a little bit more than 2 pounds. So 2 pounds, 1 ounce. And this is when they meet Dr. Taylor as well. So this is when we start the treatment. We start talking about it. You don't want to begin the treatment the day that you're going to do it. So we start talking to Heather and her husband, what we're going to do, what our plans are, and what our goals of treatment are. So just to give you a sense, craniopagus, which is this horrible term, sort of conjoined twins at the head, they're fused with their bone, they're fused at a number of layers that Dr. Taylor will talk about. But to me, as a neurosurgeon, the one I care about is the brain. Now, these are, when we say rare, this condition, it's really rare. So it happens about 6 times for every 10 million live births. Becoming president, which is super easy nowadays, it happens about once every 10 million live births. It turns out getting hit by an asteroid is just about as common as having a baby conjoined at the head. And being hit by lightning it's just damn common. And that happens all the time, once every million times. So we're talking about really rare things, and we're attempting to try a different treatment strategy to get better outcome for these kids. So that's the sort of setting of what we're doing.
So as Greg said, we're like surgical brothers. We probably spend more time with each other than we spend with our wives.
Sadly.
Who are here today, have nothing to worry about. But when you're thinking about separating conjoined twins, you kind of think about the different layers. What are the layers of the sandwich that you have to separate? And then once they're separated at those layers, you've got to put back together the kids at those layers. And with craniopagus twins, there are essentially 4 layers to think about. The innermost layer is the brain. There's a covering of the brain called the dura. Then you've got the cranial bone and the skin that overlies the bone. So those are the 4 layers we have to take apart, and those are the 4 layers that we're going to have to reconstruct. Now, there are risks and there are benefits. Obviously, the benefits are probably clear to you. The risks associated with them are somewhat medical and perhaps beyond what we need to talk about today, but the cumulative risk of this process of separating the twins and putting them back together is about a mortality rate of 40%. So almost half the time, one of the 2 twins dies in this process. So that's something that certainly weighs heavily on our shoulders as we're setting about talking to Heather and Riley about separating their 2 daughters. One may die during the process. So it kind of begs the question, well, why separate them at all then? Perhaps they'll do okay just living as they are. But the bottom line is there are a lot of things you can't do if you're conjoined twins. You really can't eat. You're supine, so you have to be fed by tube feeds. You can't hug each other. Very hard to have any kind of interpersonal relationship outside of your relationship with your sister in this case. You can't sit. You can't go to school, obviously. You certainly couldn't come to a TED Talk. So there are a lot of things you can't do, and as Albert Einstein said, life has certainly not been designed for the abnormal. So as we weighed the risks and benefits of separating the twins versus leaving them as they are, Mom and Dad chose to go ahead and have the twins be separated. So Greg and I started thinking about, well, what can we draw upon from our experience as craniofacial surgeons and neurosurgeons to try to do this successfully and perhaps a little more successfully than people have done it in the past? And so we thought about this technique we use all the time called distraction osteogenesis, where we can cut bone and gradually pull things apart to reshape or remodel the skull. We thought, man, maybe we can apply this to these twins, where we cut the bone that conjoins them and then apply a force to gradually separate them over time. Give ourselves a little bit more room to work, if nothing else. And so we teamed up with the Pew Synthes, which is a subsidiary of Johnson & Johnson, to make custom helmets that could fit on the top of each twin's head. And the helmets would be connected by screws, and as we turned the screws, it would increase the distance between the 2 heads. And so after a large amount of trial and error, that's exactly what we did. We took the twins to the operating room at the age of 3 months. We cut the bone away from that was conjoining the twins, and then we applied this device, as you can see here. And here the twins are in the night of surgery on the left, having just applied this device, and over the next several weeks, each day we turned these screws. And as we turned the screws, the twins were another 2 millimeters separated. So we achieved a separation of a little more than an inch, which in baby terms is a lot. And after we did this, we did a constriction or compression phase where we began very slowly diminishing the surface area that the 2 twins shared. And so after a couple of months of that, we felt we had maximized what we were going to get from that. We diminished the conjoined surface area by about 40%. So we were able to obtain additional room to work. We were able to decrease the amount of surface area that connected the twins. And it basically took them from this picture on the left, where you see they have a fairly angular connection, which actually has a mortality risk to it, to this more stovepipe or 180-degree opposite connection, which has a mortality benefit. We also gained more critical real estate right around the eyes, so less chance we would blind the twins as we separated them during this process. Once we finished the distraction and constriction phase of things, we fell back to a more conventional means of separating twins called tissue expansion. We put these fancy water balloons beneath the skin of the scalp where the twins were conjoined, and over a period of several months, we blew up those water balloons. By doing that, we're able to recruit a huge amount of extra skin that has hair on it, like the scalp, to enable us to reconstruct the scalp of the twins once they're separated. And that process took about 3 months. Fortunately, we were able to do it without any complications, which then brought us to the next phase of separation, or the day of separation.
So one thing I'd like to talk about right now is that these phases were in conjunction. This teamwork was at each phase we were in the operating room together, because we knew that each successive treatment required the previous treatments to work. And that's one of the teamwork facets that's really important in this. And a lot of times, each person stays in their own room and they don't talk to the other person. They end up kind of messing up the next operation by not doing it right or not thinking about what needs to be done. So at 10 months of age, which is a very young age, we brought the twins to the operating room, and this was going to be the day of separation. One of the other adjuncts we had to help us in the operating room was this navigation system, and you can think of it like a GPS. It's a map that can be loaded from the MRI, and we trace their foreheads, and then I can put a pointer on their heads or in their brain and know pretty consistently where I am, so it can increase the safety. This is a piece of technology that helps us. The other thing that I'll show in a few minutes that we used was we had 3D models of the twins that we used to create the Halo devices, and we used them in the operating room to be able to see through the tissue and know what blood vessels were and where they were. So the first step was to separate, and the plan was to go from each side to separate the twins. Now, my favorite philosopher is Mike Tyson, and he said, everybody has a plan until they get punched in the face. So while we had a plan, needless to say, we did have to react on the fly, and I think Dr. Taylor will point that out in a few seconds. So the first plan was this nice cartoon version, which looks really simple, to develop the plane between the two twins. It turns out they did share a little bit of brain, and they did share some blood vessels. This is the actual picture of the plane between the two twins. Not so easy. So I am good at what I do, so give me some credit. So we had to separate that, and we had 3 neurosurgeons there. Myself, Dr. Kennedy, Dr. Storm, we're all there to separate this delicate tissue. Another important thing about this case is usually we're removing something from a child, a tumor or a lesion. In this case, both sides of this operation are important to this family. Abby and Aaron, they're both there. So anytime you do something to one twin, you can do it to the other twin. So it's important. It increases the level of, or decreases the error rate that you can have. So once we had completed the separation from the one side, our plan, if there was swelling or something unforeseen, we're going to close up and then bring them back when things settle down. But the first separation side went well, so we turned them to their other side, and this was the more dangerous side. And it was more dangerous because of this blood vessel. You can see on the left-hand side, the red area. This is the 3D model that helped us in the operating room. And that blood vessel, which goes right down the middle of your head, carries 20% of your cardiac output, even more in a baby. And so bleeding from that, babies can insanguinate in a matter of seconds to minutes. So it has to be handled very delicately. These twins shared that blood vessel, so one had to be given part of that blood vessel and the other one had it taken away. This is sort of the cartoon version of it because nobody's taking pictures when we were operating on that part of the blood vessel. It was a little too tense. And here's another area where teamwork came in. In that room was an amazing team of anesthesiologists that we work with every day. Allison Parate, who was leading the team. And she knew we were coming up to the sinus. I'll have a certain amount of blood in the room. I'll watch that blood pressure a little carefully. There were nurses in the room who work with us every day, unfortunately for them, I think sometimes. Jenna and Roseanne, who knew how I take down this sinus, how I operate on it. So there was an unspoken sort of teamwork there. Again, you don't want to recreate teamwork when you need it. You want it to sort of be established at the time. So what we did is we dissected around the sinus, and then we had to cut across it and separate the twins. And we were able to do that pretty successfully. Then a few minutes later, after we had finished the separation, there was a 1, 2, 3, and a very profound moment where for the first time in their life, these twins were separated.
So that was a pretty magical moment, you know. It was actually 3, 2, 1, and then they were separated, Greg, but you get the picture. So all of a sudden, 3, 2, 1, and we pulled the twins apart, and it was totally silent in that room. You could hear a pin drop. Everyone was totally focused. It was awesome. And then, all of a sudden, I'm back on. Here we are trying to reconstruct the 4 layers we talked about. And so, again, This is where teamwork comes in, because we pulled upon Greg's neurosurgical expertise and my craniofacial expertise to try to do this in a way that was going to allow the twins to have the best outcome possible. And one of the things we used that was innovative was a biological patch to reconstruct the dura that could be interchanged over the ensuing weeks as needed. The other innovation was to not completely close the scalp, but to leave a little bit of scalp open. We want to leave plenty of room for the brain and everything else in there to swell and not be injured by the swelling, i.e. see increased amounts of pressure, which the brain doesn't want. So I think two of the other innovations were to not close the scalp completely and to use this dural allograft to allow for increased amounts of room for the brain to swell. And then we put the twins in a medically induced coma for 3 weeks. And during that 3-week period, Greg and I would periodically take them back to the operating room, take a look at the brain, make sure it was healthy, make sure it had everything it needed to do as well as it could, exchange the dural patch, and then slowly, as the inflammation subsided and the swelling subsided, we closed more and more of the scalp until the scalp was totally closed. And that process took about 3 weeks. But 3 weeks later, with Greg and I watching the ICU, we woke the twins up. But what was really fascinating is to see their eyes open, and you see them look around the room, and they kind of track on each other, and they had never seen each other. And they kind of reach out to each other. And we put them in the crib together, and they were able to touch each other and see each other for the first time. And just like that magical moment when we were able to separate the twins, this was a really magical moment for Greg and for me. So here, Abby and Aaron are about 4 weeks after surgery. They're learning how to eat. All 4 extremities work, their hands, their arms. They're learning how to eat. They're learning how to coo and gaga and all that kind of stuff. About a month after surgery, we took these pictures on the left, and in about 6 weeks after surgery, we all celebrated their first birthday at CHOP, and it was a unicorn theme. We loved it, and it was, again, so gratifying to see that each twin eating a little bit of birthday cake and interacting with us, with their mom, with their dad, as if none of this had ever happened. Here we are in November of 2017 as the kids get ready to leave the hospital about 2.5 months after surgery. But not only was it one of the earliest separations ever recorded, but they actually left the hospital quicker than any other set of twins. And I think Greg and I stand before you today taking some credit for all the work that was done, but these are the people you see in this picture. You see the mom and the dad holding the twins. You see Greg and me, but everybody else in this picture deserves a huge amount of credit. And this type of thing can only be done in a team. And it takes a team with a lot of expertise like that exists at the Children's Hospital of Philadelphia to make something like this feasible.
So the twins, it was really important and satisfying for the family to have them home for their first Christmas. They'd spent their entire life in the hospital. And in a way, I think Heather was a little homesick for us. I think she grew a family in that hospital. There was an Amish family that literally built a crib and a wagon for the children so that she could move them around before they were separated. So she really became like a family member, which makes it even harder when problems can occur. So I set this up as a timeline. However, these aren't individual time points. I'd really like to point out how with each time point, we were thinking about what the next level of surgery was going to be and trying to integrate our previous procedure to try to give us success with the next operation. And I think utilizing that technique where we were working together from the start set us up for success and set these twins up for success. Also, all of the additional work with the family and showing them the 3D models, we're allowed them to be part of that operation. They knew what was happening in the operating room. When you give your child over to someone, they knew what was going on, and that was important. So the early engagement was really a key to this kind of operation, and something we've learned and we use in some of our other complex surgeries. The other is the multidisciplinary team. You can't do this in a vacuum. You can't be the expert of everything, and working together is important. But you need to start that working together and that relationship well before you try to tackle something that might be a little complex. The last thing, and I think the reason that we were as successful as we were, is we harnessed the normal healing process of these twins. By doing it at a younger age, it was more risk because of the blood loss, but their brains recovered faster. They healed better. We were able to get these kids through without an infection, which is unheard of. And we were able to, the skin healed better, and we were able to do things in a different fashion. So this is our example of innovation. Although I'd like it to be our story, I think it's really more Heather's story than just about anyone's story.
No question.
And we're very happy that things turned out as well as they did. And so while we'd like to do this surgery more often, I don't think these types of surgeries come by that often. But we're happy that the twins are doing well, and this is just the beginning of their journey. So we get texts when the twins are now walking a little bit and talking. So we're very satisfied. Thank you.
Thanks.